All right, welcome everyone. I'm so glad that you took the time to join us. Dr. Jessica Collinsworth is going to be presenting today, and Dr. Collinsworth started her career in nursing as an LVN in 2010. She later graduated with her FNP and DNP from Brandman University in 2017. Since then, she has worked in interventional pain management, wound care, and is now contracted with the VA to conduct health clinics and exams for disabled veterans and active duty military. She is a certified nurse educator and began working at USU in 2018 as an adjunct professor and then became full-time in 2021. At USU, Dr. Collinsworth is the lead instructor for FNP 593 and FNP 594. She also serves on the USU Grievance Committee, produces the College of Nursing and Health Sciences newsletter, is the secretary for Alpha Beta Eta, and also serves as chair for the Sigma chapter's Communications and Awards committees. Jessica is also the mother of three, ages 7, 3, and 2. Her hobbies include gardening and home improvement projects. I'm so happy to welcome Dr. Collinsworth.
All right, thank you, Linda. Okay, good afternoon, everyone. First off, I just wanted to also say welcome and thank you for taking the time out of your day to learn more about some really important conditions that veterans of the Gulf War face. The conditions that we're going to be discussing are, for the most part, unexplained, but the VA has recognized that some of these chronic conditions and disabilities that Gulf War veterans face are from actual exposures which occurred while deployed to the Southwest Asia theater of operations after the year 1990. Just wanted to put some disclosures. Although I am a contracted provider with the VA, I'm not receiving any sort of incentive to share this knowledge and research with you all. So first, we'll go over the objectives of the presentation. I'll give you an overview of what Gulf War illness is. And then I'll go further and define Gulf War syndrome, which is just another word for Gulf War illness. There's lots of different terms for this condition. Next, I will further break down the Gulf War syndrome into its two categories, which are medically unexplained chronic multi-symptom illness and undiagnosed illnesses. And then we will look at how these are different, how we determine if one is a diagnosable multi-symptom illness or if it's a undiagnosed illness. Then we will look at the map and see where we are actually talking about. Where was the Gulf War? Where is the Southwest Theater of Operations? Just to give you an idea of which countries would be included in that region. Then we'll look at some research efforts regarding the conditions that impact Gulf War veterans and review the various types of toxic exposures that they were and in some instances are still being exposed to. Then we will look at some statistics regarding veteran suicides. And at the end, we will go over some patient education and resources for our patients that may be veterans from this era. And I'll follow up with any questions that you may have at the end of the presentation. Okay, so before we begin, I wanted to show you this video. We won't watch the whole thing, it's just the first few minutes. Just to give you an idea.
Between 1990 and 1991, approximately 700,000 men and women served in the Persian Gulf War operations known as Desert Shield and Desert Storm. Though these conflicts were brief and had few casualties, the environmental conditions were harsh.
But we were there for months and months and months in the elements, in the heat, in the cold, in the rain, in sand.
After the war, 1 in 4 service members would eventually develop a combination of unexplained medical symptoms, now known as Gulf War syndrome or Gulf War illness. Gulf War illness can affect many parts of the body, including the nervous system, the gastrointestinal system, the endocrine system, and the immune system. Because of this, its symptoms can range in severity. Common symptoms of Gulf War illness involve chronic pain, such as aching joints, headaches, gastrointestinal issues, respiratory problems, skin rashes, and tumors.
My joints, my fingers, my finger joints, my wrists, my hands, everything hurts, everything tingles, everything goes numb.
Sufferers may also experience symptoms of fatigue, such as a feeling of low energy, dizziness, or even chronic fatigue syndrome.
It doesn't matter what I'm doing. I could be watching TV and I'm just dead tired. Even though I had nothing to do the whole day, I'm just dead tired. I have no energy.
In addition, Gulf War illness may affect one's mood or lead to cognitive difficulties, resulting in depression, anxiety, memory problems, or sleep disturbances.
Sometimes you go from nothing to being too emotional. Cry for no reason.
The exact causes of Gulf War illness are still being investigated. However, it is likely that exposure to toxic chemicals played a role. Many of our service members were exposed to harmful pesticides, chemical weapons, nerve gases, and antidotes to nerve gases like pyridostigmine bromide. Because the causes of Gulf War illness are uncertain at this time, and its symptoms can range so widely between veterans, it is often referred to as a chronic multi-symptom illness or an undiagnosed illness. But that does not mean that its symptoms are imagined. In fact, we know.
Okay, so just wanted to give you that kind of brief overview of what this is, why it's important, and kind of also just give you a face to everything I'm talking about. Working with veterans, I see veterans like the one in the video all the time. They have all these symptoms and no one can tell them why they're having it, or they, are told by their primary care physician that nothing is wrong with you. You're fine. There's nothing, all your tests are normal. And so it really can take a mental toll on these veterans. And as you can see that in that video. And so just wanted to share that with you. Okay, so as you know, there are certain symptoms and illnesses that are associated with military service in the Gulf War. The Gulf War includes the Operation Desert Shield and Desert Storm, but it also includes modern day veterans that serve in the Southwest Asia Theater of Military Operations. So that starts officially August 2nd, 1990, but goes all the way up to present day. Why this is such a hot topic now is because the PACT Act was signed by President Biden just last year, and that expanded the VA healthcare and benefits for veterans that were exposed to burn pits and other toxic exposures during their service. And it actually will automatically service connect them for certain conditions such as asthma or rhinitis, just because they were exposed to burn pits during the Gulf War.
Excuse me, Jessica, do you want to put your PowerPoint back up, please?
Oh, I'm sorry. Thank you. Where to go? Okay, thank you. All right. Okay. So the VA now service connects certain chronic disability patterns based on exposure to environmental hazards experienced during their military service. The environmental hazards could have included exposure to smoke and particles from burn pits or oil well fires, exposures to pesticides and insecticides, exposures to infectious diseases that are common in those regions that we don't have in the United States. Exposure to different fuels, jet fuels, diesel fuels, solvents, and then some things were actually given to veterans intentionally, or still are, such as pyridostigmine bromide tablets, which was used as a nerve gas antidote. And then just the combination of the multiple vaccines that they're administered upon deployment, such as anthrax vaccine or botulism vaccine. And then also just inhaling there's in the Middle East, there are sandstorms, and it's just a huge amount of sand and dirt and particles that are inhaled deep down into the lungs, and can cause many different long-term respiratory conditions. And then just the exposure from smoke and particles from burn pits or anything that was incinerated during that time. Okay, so defining Gulf War syndrome. It is a group of symptoms observed in Gulf War veterans, and they don't really know why. It's also called Gulf War illness. It's a term that's used to describe a range of these symptoms experienced by veterans. The topic of Gulf War illness or Gulf War syndrome is actually somewhat controversial, as there's no clearly defined symptoms or tests. There's really limited data that demonstrates the cause of the conditions or symptoms. The actual syndrome or the group of symptoms is a complex accumulation of chronic and multi-symptom health conditions, and it can vary widely. It may include respiratory complaints, chronic fatigue, joint or muscle pain, headaches, memory problems, cognitive difficulties, GI issues, sleep disturbances, skin rashes, mood disorders, anxiety, depression, just like the video had said. Although they don't know exactly what caused it, they believe it's a result of a combination of factors, such as the exposure to all the environmental toxins we had just talked about, and in conjunction with the medications and vaccines and chemical agents that were used both for biological warfare or that they were exposed to during the war. Also just pesticides that are used in other countries. And they would also use pesticides on their clothes and just, as a personal protection against insects. Research into the Gulf War syndrome is ongoing, and there's various hypotheses that are proposed to explain its origins. In conjunction to what we had already said, all the toxic exposures, they also believe that there could be a genetic or individual susceptibility factor that plays a role in it. And yeah, it's just really important to note that it's a controversial topic, that you couldn't, look in a textbook and see this as Gulf War syndrome has these symptoms and it's a pattern that's consistent with all people, because it really isn't. It varies widely from person to person. So now we'll break down the two different categories of Gulf War syndrome, which are medically unexplained multi-symptom illnesses, which are diagnosable, and then there's undiagnosed illnesses. So the first is a medically unexplained chronic multi-symptom illness. Examples of this would be chronic fatigue syndrome, fibromyalgia, or irritable bowel syndrome. Diseases that have partially explained etiologies, such as diabetes or MS, are not considered by the VA to be in the category of medically unexplained chronic multi-symptom illnesses. And then for chronic fatigue syndrome, we may know this, but it's characterized by long-term and severe fatigue that is not relieved by rest, and it is not directly caused by any other conditions. For fibromyalgia, it's characterized by widespread muscle pain. Other symptoms can include insomnia, morning stiffness, headaches, and memory problems. And then functional gastrointestinal disorders, that would be an example of that would be IBS or functional dyspepsia. And when something is labeled as functional, that means that there's nothing abnormal found in the tissues. There's no structural alteration. Everything, all the tests are normal. It's basically based on symptoms that the veteran is complaining of. In order to make a diagnosis of any of these conditions, a full workup must have been done to rule out any of the other possible causes. The veteran must have been experiencing the symptoms for more than 6 months, and the symptoms must have appeared at least during active duty in the Gulf War or by December 31st, 2026, which that could very well change, but as of now, that is the end date. And then looking at undiagnosed illnesses, that an undiagnosed illness is established when findings are present that cannot be attributed to a known or clearly defined diagnosis. After all likely diagnostic possibilities for such abnormalities have been ruled out. Undiagnosed illnesses symptoms may include, but are not limited to, abnormal weight loss, fatigue, cardiovascular disease, muscle and joint pain, headache, menstrual disorders, neurological or psychological problems, skin conditions, respiratory disorders, and sleep disturbances. And just further note, so an example of a real patient that comes in with an undiagnosed respiratory illness, basically they're going to come in saying, you know, I have a cough or I have shortness of breath, but all the testing is absolutely normal and they're young and healthy otherwise. Their PFTs are normal, their chest x-ray is normal. On paper, there's absolutely nothing wrong with them, but they still have these symptoms. So that would be something that could possibly be an undiagnosed illness. Okay, so the location of the Gulf War, it looks like it kind of spans all over the Middle East, but there are some countries that are not included, so that's important to note. But basically Iraq, Saudi Arabia, the list that's on the slide. There's also some neutral zones in between some countries, and then also the waters that, especially people that were on ships, would be included in that. And then of course the airspace over any of these locations. The veteran would be considered a Gulf War era veteran. And for VA benefit purposes, in order to be a Gulf War era veteran, you had to have served in any of these areas from August 2nd, 1990 to present. And it includes not just the Gulf War, but also the later operations like Operation Iraqi Freedom, Operation New Dawn, all of them. Okay, so there has been a fair amount of research done. A lot of it is inconclusive. The VA has an epidemiology program that surveyed Gulf War veterans to assess to see how their health has been changing over the years. There's been 3 so far. It was in 1995, 2005, and 2012. And overall, the findings demonstrate that veterans deployed during the Gulf War reported a higher prevalence of medically unexplained multi-symptom illnesses and overall poorer health when compared to veterans of the same era, but ones that were not deployed. And this is just a resource that has tons of information about the different research that they did and the findings. It's done by the Health and Medicine Division, which used to be called the Institute of Medicine, but they changed their name. And it just demonstrates the possible connections between Gulf War veterans' illnesses and their exposures during service. And then I just provided the link. The book is free to download. It's pretty interesting. Okay, so next we will go through all the different toxic exposures that Gulf War veterans were likely exposed to. In some instances, they're still being exposed to it, and in some instances, they may have not had any exposure, but it's really difficult to determine, and we'll go through why in some instances, because when you're in a region, you don't really know what you're breathing in, or you don't know, what you're ingesting. So. Okay, so the first we have kind of already talked about, but it is burn pits. And for anyone that doesn't know what that is, it is literally a giant pit that was used to burn anything that was considered waste, including garbage or even human waste, the liquid from latrines, literally anything that they didn't want anymore, they would burn it. And often they would use various fuels, jet fuels, diesel fuel to ignite what was inside the burn pit. And as I'm sure as you can imagine, there's a lot of fumes, toxic particles in the air from that. They were used in many countries, and this map shows the countries where they were commonly used. And it was really a common practice, and the Department of Defense has now closed most of the burn pits in the Southwest Asia Theater of Operations, but some are actually still being used. There are plans to close the remainder of them, but some are still active. There are many conditions that the VA considers to be caused by burn pit exposure, and they do not require any proof. Basically, if you have the documentation showing that you were deployed to anywhere in the Gulf War region after August 2nd, 1990, and you have any of these diagnoses listed, they would automatically service connect you for it, and you would get benefits, or the veteran would get benefits. So as you can see, lots of conditions, lots of different types of cancers. The most of that paragraph here, they're all cancers that you can possibly get from being exposed to burn pits, and in addition to chronic bronchitis, COPD, and the rest of those conditions listed. And these are a lot of common, maybe not the cancers, but the rest of them. We see COPD, we see rhinitis, sinusitis a lot, but it's really shocking to see a 30-year-old veteran that's otherwise totally healthy come in, and he has basically COPD and no history of smoking. So yeah, it's very, very shocking. Okay, the next one is vaccinations. Some of these vaccines are really common and people get them all the time and they're totally fine. But what is notable is that a lot of times veterans will get all of these vaccines in a very short period of time, which they don't really know if that is harmful or has any long-term consequences. Before service members deployed, they are subject to receiving several vaccinations, such as yellow fever, typhoid, cholera, hepatitis B, all the ones listed there. They also receive anthrax vaccines and then botulism vaccines, which are obviously not given to most of the population. And at this time, is the Institute of Medicine says that there's inadequate or insufficient evidence to determine whether there is an association or there isn't, basically, with long-term health problems with these vaccines. So time will tell, and they are still doing more research. Okay, so chemical and biological weapons. So basically in the Middle East, sometimes there would be rockets filled with biological weapons and chemicals that were harmful or are harmful to humans. Rockets filled with sarin and cyclosarin mixes were found at ammunition storage depots in Iraq, and those depots had been demolished by U.S. service members following the 1991 Gulf War ceasefire. And an undetermined amount of these chemicals was released into the atmosphere. So people could have been inhaling this and they had no idea. Several studies assessing any correlation with sarin and brain cancer have been done. And the most recent update was in 2017. And it indicated that U.S. Army veterans possibly exposed to sarin in Iraq from those demolished ammunition storages had similar rates of brain cancer mortality compared to those not exposed. However, veterans possibly exposed had a higher risk of brain cancer in the time period following the Gulf War, which is interesting to note. There does seem to be a correlation between these biological weapon exposure and brain cancer. So that is one of the presumably service-connected conditions. Basically, they don't require any proof that they were exposed to anything. If they have brain cancer and they were in the Gulf War region after 1990, then they would automatically be service-connected for it. The next toxic exposure is depleted uranium. It is used on tank armor and in some bullets to penetrate enemy armored tanks. Small particles have been inhaled, or small fragments could have been scattered and became embedded in the body. Research is still being done, but data shows there is an association between elevated urine uranium and decreased bone mineral density. So the next is kind of maybe one that we would think of more commonly, which is just noise. Being deployed overseas in a war zone, or even if it isn't an active war zone, there is a lot, the helicopter noise, jet noise, explosives. If they're using a weapon, there's just a lot of potential noise. And, we know as healthcare providers that exposure to long amounts of high decibels can really damage our ears. And it can, of course, result in hearing loss and tinnitus, which is another common condition, not only of Gulf War veterans, but veterans in general. The next one is called CARC paint, but it's chemical agent resistant coating. It's used as paint on military vehicles to make the metal surfaces really resistant to any corrosion or penetration of chemical agents. It's hazardous to inhale while painting and during the drying process or during any welding or sanding. The CARC ingredients include isocyanate, which is highly irritating to the skin and respiratory symptoms. High concentrations can cause itching, redness of the skin, burning sensation in the throat and nose, watering of the eyes, cough, shortness of breath, pain with breathing, increased sputum production, and chest tightness. Inhaling high concentration of solvents can cause coughing, shortness of breath, watery eyes, and respiratory problems like asthma. And then toluene, high levels of toluene released during the drying process can actually cause kidney damage. So then we have an array of other potential occupational hazards and exposures that would really just depend on the veteran's specific military occupation. But it could range from asbestos to additional solvents, lead, radiation, diesel or jet fuels if they're either airborne or in the Air Force, coolants, and just even vibration. Vibration is known to cause peripheral nerve damage. So any of these have the potential to cause an array of symptoms associated with undiagnosed multi-symptom illness or undiagnosed illnesses. And then we talked about this a little bit already, but pyridostigmine bromide was a nerve agent antidote given to veterans. It is important to note that it was given to them as to self-administer, so it's really impossible to determine exposure, but it is believed to be a possible cause of chronic multi-symptom illness. And although the VA has concluded that the current evidence does not support any association between the administration of this medication and any medically unexplained illnesses, they still presume that certain medically unexplained illnesses are related to Gulf War service without any regard to cause. And yeah, so their exposure is not known. The pills were self-administered, so it's really difficult to say who took them, who didn't take them, or who took them correctly, etc. And then there's pesticides, which is somewhat of a more routine toxic exposure we would think of. But veterans often use lindane to treat their uniforms, or they're actually pre-treated to help deter different insects or lice or scabies, etc. They also use DEET, just like lots of people do here. It's used as an insect repellent. And then organophosphorus pesticides, which are used to kill various insects. Those were actually only used by specifically trained individuals. So again, it would be something that would depend on the veteran's actual military job. And then permethrin, which we commonly use for lice or scabies. That is one that the VA recognizes as a potential toxic exposure, but currently they say there's not enough evidence to support any association to this Gulf War illness. And then sand, dust, and particles. So in the Middle East, there are sandstorms, which, we see that they would see the sand, but there could also be an array of different pollutants or particles, particulate matter that you wouldn't be able to see, and they could be potentially toxic or cause long-term health effects. And also just, regular vehicle exhaust, construction and farming site emissions, and the dust that all of that kicks up. Research is ongoing, but it is believed to be a contributor or a possible cause for many respiratory or cardiovascular conditions. And then toxic embedded fragments, which would be basically shrapnel or particles that were from explosions, blast injuries, bullets, anything that remains in the body after an injury. And like we had said earlier, they use the depleted uranium or the Kark paint on the coverings or the paint to protect the tanks. So if that gets exploded and a piece of that goes in your body, then that's a direct access point to all those toxic chemicals, and it is being constantly released in your body. There's actually a program in the Baltimore VA Medical Center. It's called the Toxic Embedded Fragment Surveillance Center. So they're doing a lot of research about that. And that is definitely one of the things we look at when we're doing these Gulf War exams to assess for any possible shrapnel or embedded fragments. And then infectious diseases, which, may be common to that region, but it's not something that we in the United States really have to deal with, or there's not very much of it. The VA presumes that any of these infectious diseases are related to military service. And the veterans must have had the diseases within the timeframes, from 1990 until present. And they must have a current disability as a result of these diseases. Let's see. So I think we probably know what a lot of these are. I was not familiar with Q fever. Q fever is a bacterial disease with symptoms like fever, headache, GI problems like nausea and diarrhea, and it can become a chronic condition, and the illness may cause inflammation of the heart. And so in order to be disabled or have any disability with that, it has to be done you have to have symptoms or a disability within 1 year of leaving the military. And then I think the rest of them we probably know a little bit about. Okay, and then the last one is heat injuries. So of course, they're out in the middle of the desert. They're prone to heat stroke, heat exhaustion, sunburn, and there are actually long-term complications associated with these conditions. Veterans who suffered from any heat injuries during military service are actually more susceptible to heat and more serious heat injuries in the future. And that actually doesn't just go for veterans, that goes for anyone. When someone has heat stroke, it can cause cellular damage, or they won't be able to recognize that their body is overheating because they've had that damage. So it's really important. It could definitely become a chronic condition because they had the original episode of heat stroke or heat exhaustion during service. Okay, so I just wanted to bring this part in. It doesn't really have anything to do with toxic exposure or the multi-symptom illness, but it's notable because veterans have the highest rate of suicide. It's much higher than the general population. And there is a potential that chronic disability patterns, especially when they're being told that there's nothing wrong with you, you're fine, all your testing is normal, that these chronic disability patterns could contribute to a significantly higher number of veterans that commit suicide every year. Data from 2020 showed that veterans had an adjusted suicide rate of 57.3% greater than non-veteran US population. And a 2021 survey indicated that adults with disabilities are 3 times more likely to report suicidal ideation compared to those without disabilities. So it's just really important to just be aware of that veterans have a way higher suicide rate than other populations. And people with disabilities also have been known to have an increased rate of suicidal ideation. And then here's just some statistics on the most recent veteran suicide statistics from 2020. So 16.8 is the average number of veterans that commit suicide per day. The total is a little over 6,000 veterans a year that commit suicide. It's the second leading cause of death for veterans ages 18 to 44, which captures the Gulf War veteran era. So like I said, Gulf War era is from 1990 until current day. So that captures your 18-year-olds and goes all the way up to 44. So there is something there that that these veterans who have these undiagnosable or medically unexplained illnesses also have this. The second leading cause of death is suicide. And 42% of the people from this study in 2020 did not have any documented or known mental health conditions. So it's very shocking, and it's just something to be aware of. So I just wanted to leave you with some patient education. As healthcare providers, it's of course important to identify veterans in our patient populations. It's also important to know and let them know that the VA offers eligible veterans a free Gulf War Registry health exam. This is something new with that PACT Act that was signed by President Biden last year. And the purpose of the exam is to find possible long-term health problems associated with their service in the Gulf War. The VA, of course, also offers healthcare, disability compensation, and other benefits to eligible veterans. And it could also cover their dependents, and survivors may also be eligible for benefits. Right, and so here's my references. And now I will open it up for any questions, comments, concerns.
Thank you so much, Dr. Collinsworth. That was very interesting. And, you know, as I was listening, I was thinking, I have a friend who works in an oncology unit, and even, you know, with seeing patients there, I'm going to make sure and mention it to her that if she sees someone that has a history of military service, you know, the patient may not even know
I
that,
know,
you know, they have these benefits. And so that's something that I'm going to pass along and certainly remember in my practice too.
Yeah, great. Thank you. Yep, that was definitely my purpose of doing this. I realize most people don't work for the VA, but we see so many veterans that maybe we don't even know that they were veterans. Maybe they were only in for a couple of years, but it's still important because of those exposures.
I do have a question.
Sure.
My name is Ruth.
Hi.
So we know that stress can cause autoimmune disorders. We know that IBS is a autoimmune disorder now that we're learning. Given the fact that all of these really can be linked back to autoimmune, which is the disease of the civilization, I mean, are they reaching out and starting to think about doing more autoimmune protocols?
So really, it would be depending on the provider. If the provider suspects that could be a cause of it, then they would need to do their due diligence to rule out any possible autoimmune disorders. It would really be a case-by-case basis. For the purpose of disability or compensation, it would be, has this veteran had a full workup? Can I rule out autoimmune disease? And if you can't, then you wouldn't be able to connect it to their service. But in some instances you can. It would really just depend on a case-by-case basis. And a lot of it, the VA relies on their providers to give medical opinions. And your medical opinions are just based on as you can tell, the very limited evidence that we're given. And you just say, you know, based on this evidence, this is my opinion based on their lab work, based on their workup. So it would really just depend on a case-by-case. But yeah, that's a good question. And it may be something that gets developed further as more research comes out. And this is a brand new thing, really. It just came out last year, the PACT Act, to expand all of these services. So
Great, thanks. I don't see any questions in the chat at all. So anyone else have a comment? I see a couple thanks. Dr. Hinton, Dr. Ogunjimi both say thank you. Dr. Collins said thank you too.
Saying thank you to them.
Wonderful. All right. Well, thanks everybody again. I will be sending out certificates probably tomorrow. Nice to see you. And then I'll send out the recording so that everyone else can get a chance to view this.
All right. Thank you so much.
Have a great day.
Thank you. I enjoyed it. Take
Bye.
care.
Thanks.
Bye. Bye.